Hello, everybody. All right. So let's receive patience once again. This time around, I'm not going to do too many introduction. I just need to be sure we can hear you first of all. Okay. So, uh, patience, you are welcome back.
Thank you. Can you hear me now?
Oh, that is brilliant. We can hear you. I
Oh
hope
my
you can
goodness.
hear me as well.
Yes, I can hear you. I can hear
Oh,
you. Hello,
okay.
everybody.
Let's
Hello,
confirm
hello.
if people at home can hear you. If
Can
our
you hear
audience
me
can
at
hear you.
home? Can you hear me? Maybe just a thumbs up or something. Just a yes in the chat, something. I can
Oh,
see
someone, is
Jenny.
that a flower?
We can hear you. Okay,
We can
perfect.
hear you.
Thank you
Okay.
very much, Safe Heaven. Thanks for everybody for joining. Really sorry about the glitch, but
Okay.
you know what? That was practical. Okay. Things like this can happen in a teaching career. When you have audience in front of you, you're ready to go, and the technology
Mm.
just starts. I don't know what happened. Um, the host was kind enough to call me last night. I mean, yesterday evening. We went through it, everything. Everything was fine, and today the technology just decided to mess up. But you know what? We can't just give up. We have lost nearly an hour, but trust me, I'm not going to talk for just 9 minutes. If you're, as long as you want to stay, we're happy to offer you the 1 hour that you expected, if that's okay with the host.
Yeah, that's
um
fine.
yeah, that's okay. So my name
So
is
thank
Patience Bamishaye, as you already heard from the host, and I am a senior lecturer in one of the universities here in England. I don't know about the terms and condition, if I'm allowed to mention the university or not, but I know my audience. Some of you know me already. Some have met me at uni, and I am also a registered nurse. With the NMCP in England. And I am, guess what, an internationally educated nurse. And I'm so proud of it. Um I came in many years ago to do my master's degree. And after that, I decided, you know what, I'm just gonna get my pin and practice with NHS. So
very, very,
um
very lovely to have you with
thank you
us.
very much.
Patience is a privilege to have you.
Thank you.
It's every time I interact with you, there's always something to learn, and that is like the highest compliment I can give you, because
Mhm.
like you really said, in my little experience in teaching, I've experienced this kind of situation where I was observing a lecture and the lecturer was all set to go everything and the PowerPoint is not working. The projector is not working. And so sometimes things like this happen and you need to just be proactive enough to deal with it as well. So it's also part of our learning,
Yeah,
I
absolutely.
suppose. So to
Yeah,
start off,
yeah.
Patience, can you talk us through your professional journey from Nigeria to the UK to the
Okay.
NHS and to where you are today?
All right. Thank you very much for the opportunity. I am a good talker. I talk a lot. So just as I'm talking, if you have any question or you want to interrupt me at some point or you want me to change the direction, feel free to put it in the chat. I'm sure the host will pick it up and interrupt me when where he can, and then I'll pick it up from there. So like I said, I'm an international educated nurse. Like some of you here, we went through I went through a school of nursing and not doing nursing at the university. So you come out with a diploma. After practicing as a nurse in Nigeria for quite some time, I decided to come over here and do a top up degree um, to get my BSc, and then proceeded to do my master's degree in nursing. Um, Before I carry on or before I forget, I just want to let you know that my senior lecturer job is actually being a course lead for the international nursing course, the same course that I did many years ago. I am now the course lead. So if you're here, you have your diploma and you want to do a top up to get a degree, you can get in touch with me and we'll talk more about that. Okay, I'll be looking after you at the university. Anyway, I
So we'll charge you for that announcement.
that's okay. um I'll pay in kind, Adekola, don't worry about it. So after doing my master's degree, like I said, I did an adaptation process. I didn't do the OSCE and CBT that some of you are doing right now. I went through the adaptation process, which I felt was quite a nice way of adapting into the UK system. However, there was still a lot that was new to me. I was scared, just like some of you, and I went on anyways. So I got the pin, got myself a job in the NHS, and I started to work. What I did was that I got a job in one of the busiest part of nursing care, which is surgical care. With surgery, it comes with a lot of acute care, deteriorating patient, all sort of busy things. I decided to do that because I wanted to learn what I didn't know. Nursing could be the same, but it's different. So some of us are coming from a background where some equipment in the NHS right now we haven't seen before, some procedures we've never seen before. I have not never known about vac dressing, for example. I saw it for the first time in the NHS, so that was part of my learning process. So I got myself deliberately in that busy ward because I needed to learn. I had a plan, I needed to proceed, but I didn't know when. So I decided to go in. Going into the NHS, unfortunately, I wasn't lucky with managers. Okay, I was working in a white dominated environment. I am very confident to talk about this because I know that there's someone out there that might be going through something that I went through. So my manager wasn't 100% supportive. So I did feel very used and abused. I was only good for what I could offer. Okay, so
Mm,
every difficult procedure or any skill that is difficult for everybody else, they'll be like, oh, where is that international nurse? Where is that overseas nurse? Come, I know you can do this. Come and do this. So when it comes to cannulation, venipuncture, NG tubing, catheterization of male patient, female patient, is always patients, patients, patients. However, I'm not complaining. It's my job. I loved it. However, when it came to career progression, I wasn't given the opportunity. If I want to progress, they say, oh, patience, not now. You're just coming. I was just taunted in my growth and I was abused in so many ways. And I know some of you here could relate with it. And at some point, I said to myself, after getting this experience, I may need to get out and pursue my career somewhere else. And I thought about teaching. The reason I decided to think about teaching was because on the ward, I always support student nurses who come for placement on the board. I was more or less like their mentor. And guess what? When I applied to go for the mentorship course, I was not given the opportunity. Part of it probably was because I was an overseas nurse that was only good for the skills she could offer. Part of it was I don't know, maybe just wickedness from my manager. I could say this anytime.
mm,
This is life, and I hope she's watching because she at least she will realize what she did to me. But I'm grateful. Sometimes when you have challenges in your lives, challenges just pushes you to your destiny. Where I am now, I'm so happy. I'm
absolutely.
flexible. I enjoy what I'm doing. Guess I was actually supporting student nurses on their placement, doing all the paperwork, doing all the practical work, but I was not allowed to sign them out. Someone else who did not support the students will sign them out simply because they have the mentorship training. And I when I asked to go for the mentorship, they said no. So I felt used, I felt abused. So I said to myself, I am going to go into teaching. So there might be a question going into your mind. I'm going through your mind right now to say, okay, did she have a background in teaching? How did she get herself into this teaching? I will answer that question. Okay. So unlike some places that we come from, like where I come from in my country, before you get into teaching, you should have maybe a master's degree, a PhD, and you should have, some publication. There are criteria. But one thing I got to know about this country is that if you are very good at something and you do it really well, you could convince someone to mentor them or to even be a lecturer in the university. And there are different ways to get into lecturing in the university. There are levels of a PhD holder and the job description will specifically specify as such. There are levels where you have to have a master's degree, and there are levels where you just need to be very good at clinical skills. And that was where I started from. I was very good at my nursing skills. I found a university that was advertising a clinical skills tutor. That means I'm doing more or less like a bedside nursing, but in the university, if you know what I mean. And this time around, I'm not just supporting or mentoring one or two students who I may not be able to sign them up at the end, but I am supporting much more students in a clinical lab doing wound dressing, infection control, manual handling, basic life support, all sort of things. And my name is scribbled on their procedure book as the trainer. That was it. And and how did I get in? I was just asking question around. I was attending events. In fact, the particular place I heard about this um vacancy was in an event. It was a staff event, and I decided to go. I remembered that day I was actually looking for a shift. Some of us will relate. Some of us normally sometimes cancel um, social events for shifts. Have a bank shift. And no, I'm not going to attend. Sometimes attending event is good, not just for your personal being, just for you to meet people. It's also good for you meeting your destiny helper, you
Mm.
socializing,
Mm.
networking, getting that opportunity that you needed all this while. So I met my destiny helper at that event. We are just talking, so how is the NHS, how is your experience? And I said, you know what, I'm getting fed up, because this is how I feel. I don't feel valued, I feel used. And she said, and I told them about my mentoring students and not given the opportunity to go further. And then this person just asked, have you thought about career in teaching? I said, teaching where? She said, the university. I said, why not? I don't have experience teaching in the classroom, but I could teach. I've been teaching students in placement. I teach my colleagues on handover. So the reason I'm saying this is because do not overlook any tiny skill that you have done before. Even if you just mentored a student on the ward, you can repackage that and put it on your CV, and that will be a skill your employer will be looking for. Okay.
Absolutely.
So I said to her, of course I can't do it. Especially when I told her I'm being used for all the procedures in on the ward, because an overseer nurse tend to be a master of all. And she said, oh wow, we're looking for a clinical skills tutor. How does that sound? I said, great, wonderful, why not? And then she said, okay, patients, that advert is closing that week. So if you have to apply, maybe you need to do that tonight or tomorrow. I say, I'm getting at it right now. In fact, I left that event early to go and brush up my CV. Talking about brushing up my CV, it is important that you look at your CV anytime you are applying for a new job. Look at the job description, look at what that employer needs, um, look at the person's specification, and then compare it with your CV to see if you actually have the right skill that they're looking for. If not, repackage it. Just think about something you've done. Is it leadership skill they're looking for? Think about any time at your workplace that you demonstrated leadership. Repackage it, just reward them, put it on the CV, and then just be ready to defend it. Yeah, so that's what I did. And then I went for the interview. It may interest you to know that that interview, the advert was actually for a part-time job. It was for a part-time clinical skills tutor, and that was because I think this one of the staff was going on a leave, maternity leave, or maybe on a short break. But I went for it anyway. It didn't put me off. I said, I am going to go. The worst that will happen is maybe they will just say, oh, patience, you're not the kind of person we're looking for. Or maybe I'll just have the experience of going for the interview. I did talk with some of my friends who said to me, oh, patience, what are you looking for? You already have a tier 2 visa and you are with the NHS. Why would you like to leave? Just stay here and improve your career. Your manager will not do this forever. She will change. Blah, blah. I said, okay, that's fine. I've heard you, but I'll go anyways. Some even said to me, because you're black, you may not get sponsored. Universities don't generally give sponsorship, just speculations. Why am I saying this? Do not let anybody discourage you. Remain focused. If you want something, go for it. So long as it's not going to hurt you or anyone else, there's no harm in trying. Okay. So I went for that interview. Oh, well, I did the application, and gladly I was shortlisted. After the shortlisting, I went for the interview. The interview, it may interest you to know that it's actually an hour. So you have the first 15 to 30 minutes to demonstrate that you could teach. You know, some of us are born teachers, some of us is in the blood, some of us we learn to teach. So it depends on where your passion is. Do not give up on yourself, believe in yourself, go for it. So I did my first session of teaching. They just said, okay, they'll give you a very simple scenario, maybe just teach us about vital signs. How do you teach student nurses about vital signs? And they'll give you time. So you need to prepare a PowerPoint if you like, or get the equipment if you like, do something that will convince them that you're the right person. So I did that. And then the next session was for you to face the panel for questions and answers for you. Tell us why you think you're the right person for this job. And that is the opportunity for you to showcase, for you to speak out, for you to defend yourself and tell them, I am the best person for this job. And if you don't take me, I'm going to say that you will lose a lot, because I have a lot that I can offer. It's okay to package it the way you want to package it, but I did that. I told them I'm the right person for this job. I'm aware that this is a part-time job, but I am available for full-time if you need me. Right now, I'm in the clinical area. I could do a part-time clinical skills. However, if at any point you need a full-time job, I want to do this as full-time, and you would give me sponsorship. I need you to give me a sponsorship. Um, I know that not many of us will have that audacity to say this in the panel. Guys, when you have the opportunity to face any panel to justify yourself, it is your opportunity. It's one shot. After that, at the end of that interview, you may not meet these people again. So any good thing that you have that you think you can showcase in front of this panel to convince them that they need you, please use it. Okay. I said to them, I'm going to tell you why it will benefit you to give me a sponsorship, because most times, in fact, surveys or research has shown that when people are being sponsored, they tend to be loyal to their sponsor. And even legally, if you give me a tier 2 visa, I know I'm working with Anglia Ruskin, oh my goodness, or
It's
UCL, or I'm
okay.
working
It's
with
okay.
whatever university, you know that you I am working with you and I'm not going anywhere, or Middlesex hospital, I'm not going anywhere, I'm with you. But if you employ someone else who don't need any sponsorship, this person has nothing to lose. If they start to work with you and they get bored, they're just going to leave.
After a
you
month,
know
they can move away.
they can move away without feeling guilt. They can just leave. But if you give me that sponsorship, and with my skill, I know what I'm going to offer, you will not regret it. So, and then
Apparently, you were able to convince them and got the job, and obviously
yes,
that's where you are today. But can I ask?
absolutely.
There's this uh is it speculations now, or just this
Myth.
thought that myth that when you move into teaching, you probably lose a lot of money, because it is a fact that you don't work weekends, you don't do maybe you don't work on bank holidays, you don't do on social hours. So, and we know what impact that could have on your income. There is also myth that you de-skill, you lose a lot of skills, and probably lose progression as well. I've seen few people interact with me, and they'll be like, oh, I'm very close to being a band 6 now, so do I want to lose all the hard work I've put into getting to this level and go and start afresh from from the scratch in a new career pathway? What do you see to that? Do you feel the same, like you lose money, you lose skills, and you probably have to take a step back to start afresh?
Okay, that's a good question. Thank you very much for asking. For me, stepping up from band 5 to where I am now, or where I started from, was upskilling. and not losing.
Mm.
And just to put it out there, there's no such thing as losing skill. You just gain new skills, you know.
Different set
uh,
of skills.
yeah, a different type of skill from what you knew before. As a lecturer coming from a bedside, I can say that I have read and researched much more than I ever did in bedside. I find myself reading a lot. I find myself researching a lot. And that is because people are depending on me. Like I am teaching. So when I'm teaching, it must be evidence based. It must be something that is evoked, something that is going on right now. You have to research and keep up to date with everything. So my knowledge improved rather than going backwards, as the myth would say. That's one. And for the money, guys, coming from a band five and starting as a full-time skills tutor. Okay, so in my story, I told you it was a part-time. Guys, I was later offered the full-time. Okay, long story short, I was later offered the full-time because the panel felt like they were happy with what I said to them I was going to do, and they took the bait. So I was happy. So starting as a full-time skills tutor, your money is way above band five, it's way above band six, maybe it will be close to band seven or eight. That is starting salary for a full-time clinical skills tutor at the university. So for someone to say, "Oh, you're losing money," is a myth.
Mm.
And your weekends, you're not working. You don't have to wake up 7 a.m. and come back 9 p.m. On I know the times have changed now for our shift, but when I used to work with the NHS, I go 7 a.m. and I come back 9 p.m. That was horrendous. That was stressful. And on top of that, I don't look forward to it. You know, I'm not saying this to discourage anybody at bedside. I respect anyone else that is on the bedside. Thank you so much. I do believe that we deserve more than a clap, especially if you're an internationally educated nurse. We do deserve much more from the government, from our managers, from our mentors, from our patients, from everyone, because we put in so much to come and support the NHS. So leaving the bedside and going into into teaching is not a loss at all for me. Okay, it was a win-win. It was a gain for me, money-wise, skill-wise, knowledge-wise, and the teaching aspect. If you're worried that, oh, I haven't taught before, I'm going into university to start teaching, the university will actually, well, depending on what university, I think most university, my university gave me a package that allowed me the first um the, f- the first 1 year of my starting the job, you will be trained postgraduate certificate in education, and they will pay for it. Okay, it will be as part-time as you're teaching. They're training you classroom ethics, they're training you assessment, they're training you managing challenging students, they're training you all sort of things to prepare you for your teaching. And the university system, I'm so glad, I'm so happy with the university I'm working with, because the support system is wonderful. We have mentorship system. Somebody mentored me. They will hold you by the hands. They will check that you're okay. They might even observe you when you're teaching, give you feedback. Talking about feedback, feedback actually helped me a lot. When I'm teaching, I ask people, can you just give me a feedback? How did I do? What did I go wrong? How can I improve? That helps a lot. And don't take it personal when people give you feedback. People who are kind enough to give you feedback, they're only there to improve you. Okay. And that was what helped me. So it's never a loss,
Thank
it's
you,
a
thank
win.
you, thank you for that insight. When I started as well, I remember we met with the vice chancellor of the institution, and he was saying to us, because there are a couple of us that were new into teaching, and you could see the nerve in us. We're just wondering, we don't know what we are doing and things like that. So he said to us that they are 100% aware of our inexperience in teaching, and they are happy to have us, because, like, if I quote what he said now, he said, we can teach you how to teach, but we cannot teach you the skills you've got. So they're actually employing you based on the experience and the skills you've already acquired, not necessarily your teaching skills. That is something very easy for them to teach you and train you how to teach. And
Mm-hmm.
to be honest with you, the support is also there. We've got a
Yeah.
question in the chat box from Christina asking, "Thank you for sharing your story with patience. Do you mind sharing how you progress to becoming a senior lecturer, please?"
Okay, thank you. That's a great question. So when you start teaching, I started to teach as just as clinical skill tutor. You get sessions when you're being observed. So your teaching skill get observed by any random person that your manager may choose, or your deputy head, anybody may choose to come and observe your teaching. And when they observe, you may be observed one, twice, or maybe three times, depending on what the plan is. And after the observation, they give feedback to your line manager to say this is how she's doing or this is what she's not doing. And then they just keep track of it. When your appraisal happens once a year. So you get promoted. The promotion happens differently for different people, depending on how fast you progress and how happy the team is with your skill. So for me, I only got to be skills tutor for a year. Glory to God. I believe in God. Okay, I can't talk without mentioning God was so gracious to me. Just after my first with during my first appraisal, um appraisal means just checking what have you done well, what have you done wrong, what is the area of improvement, what is the next thing you want to do, you know. And let me talk about appraisal a little bit. Well, if you're here, you're just starting your job, or you're into far into your job and you're preparing for appraisal, you need to prepare some of these questions. What has gone well? What has gone wrong? What are you still struggling with? What is going forward? What would you like to do? Because that is the point where they might approve your progression. Maybe you want to do your master's degree, put it there in your appraisal. If you want to do your top up BSc, put it there in your appraisal. Or if you have a research topic and you want to do your PhD, do it, put it, because that's what I did. Okay. So during my 1 year appraisal, I had evidence of how well I have done, because over that 1 year, I have had so much feedback from students, from colleagues, from everybody, giving me how the feedback of how great I was as a teacher. I had constructive criticism as well that I have worked on. So I was able to feed that back to my manager and even show her the evidence. And then shortly after my appraisal, guys, there was a senior lecturer position that came up and I was offered. Say, Patience, do you want to go for this interview? Because I think you're ready. That was what my manager put to me. Say, I think you're ready to proceed to the next level. I would recommend that you go for this interview. So at the senior lecturer position, you don't just get given, you go for an interview again. Okay, and during that interview, you just go through what you think you can do, and to prepare for it, you just read through again person specification, um, job description, and then match it with your CV. What you've done within the 1 year, do you think you can do it? And being a senior lecturer now moved me out of clinical skills. My students still miss me a lot. My skills students still miss me a lot. I didn't go away completely from skills. I still do skills once in a while, but being a senior lecturer just meant that I now had a group that I do more of classroom teaching, lecturing in a big lecture theaters. I prepare assessment and I evaluate them. I give formative feedback and I mark. As a skills tutor, you don't get to mark anything. You just do your skills assessment and that's it. But as a senior lecturer, you get given more responsibility. So that was how for me, my progression actually happened so quickly. That may not be the same for everyone. Maybe because the opportunity presented itself, there was a vacancy and they needed someone and they thought I was there and I was ready. Or maybe the progression for me came like that by the grace. Everything happens by the grace of God, but it happened at the right time. I was just glad, and that I actually would not take that for granted, because there were people I met at the university who were not given that opportunity to go. I don't know if they went for the interview, because you don't get told who else applied. But I was given. and it was quite strange that they were still down there and I moved.
All glory
Yeah.
to God.
So glory be to the Almighty. He's been faithful. And
So for
what does not kill you will only make you stronger. And that's what I believe in. Yeah.
brilliant. So just for someone that's uh, thinking about transitioning into teaching and still working on as a bedside nurse now, are there any trainings or skills or courses that you probably recommend that we can start doing to gain advantage?
Okay. So if you're at bedside and you want to progress into teaching, I would say
I
check,
like the word progress because you started using progress now.
yeah, progression, career progression. So getting into teaching is good. Um, I would say read around where you want to go, because teaching comes in different styles, different forms, and different specification. Like I said, for me, I started as a skills tutor. For you, maybe you just want to start as a lecturer, you just want to teach, or maybe you want to be a lecture practitioner. That means you still be on the ward. Like I said, you don't necessarily need a master's degree to be a lecturer practitioner. So you can still be with your NMC pin, with your experience, you can be a lecturer at the university, a lecturer practitioner, and then progress from there. Okay. And then when they ask you what you want to do, tell them you want to do your top up or you want to do your master's. So whatever level you want to progress, read around it. What would it require me to do? Do I have that skill? If I'm allowed to do A, B, and C, do I know more about it? Do I need to improve? Read around it, study around it. If, excuse me, maybe you have a BSc and you think, oh, I need to get my master's first, that is a myth. You don't necessarily need to have your master's first. You can get into teaching and then get them to sponsor your master's. Okay, as I'm talking to you right now, I have put it to them that I need a PhD and they're sponsoring me to do it at my own time. Okay, it's going to be very nice and steady. It's part time while you're teaching. So read around it, get yourself prepared, get your CV prepared, and you can do it. Then, when you get opportunities, like for me, when I was being pushed, the students were being pushed to me, don't refuse those opportunities. Use it to prepare yourself. Okay, mirror yourself teaching while you're doing it with these students on a less stressful environment. No audience are waiting for you at the end, at the other side of the laptop, and technology disappointing you and all sort of things. It's just you and them. Okay, very very informal, and you start to prepare yourself. Start talking at handover. Talk like a teacher, a lecturer that you want to be. Start to get ready, and then when the time comes, it's not very stressful, it's not rocket science. It has to do with the mindset, and if you're ready and remaining focused. That is my opinion about this.
Thank you so much. If I may just add on top of that as well. Okay, if you are really considering transitioning into teaching, in your current role, you just need to start putting yourself forward more, especially when it comes to supporting students. So if you are not a practice supervisor, you need to take your practice supervisor training, be a practice assessor, and deliberately get involved with what is going on with the students. Get involved in their midpoint interviews, their final interviews, all those things that they do, the HIPADs or whatever. It can be challenging, but because you know what you want, so because at the end of the day, like our patient said, when you are presenting yourself, when you are selling yourself, these are the things you're going to package and tell them, oh, you've got experience supporting students, you have experience navigating the electronic placement documentations, you have all this knowledge as a practice assessor. And even if you end up getting the role, you can always draw on those experience again because now you're on the other side. So, and as a practice assessor in your uh, in the clinical role, you'll be having interaction with academic assessor from the university. So that channel of communication as well is going to help you to have a bit of insight into what the role is all about. And at the end of the day, when you are switching, it's going to help you. Every NHS has these practice educator roles as well. Some call them practice facilitators, some professional development nurses. They call them
Yeah.
different. They call them different names. Sometimes you can put yourself forward to support them with teaching sessions or skill
Yeah.
sessions, when even if it means your downtime, because you know what you're looking for. And
Mm-hmm.
these are the things you are going to package at the end of the day and say, okay, you've been involved in teaching, you've been doing this, and put everything together,
Yeah.
and sell yourself. So you don't necessarily have to be a qualified teacher, as it were.
True.
We've got someone asking, do you think it's possible to move from charity sector into teaching? I don't really understand what charity sector is, but I guess my boss will know. You have more understanding about that.
My guess is as good as yours. Charity comes with different meaning. Charity, what are you doing in charity? Are you doing bedside nursing? Are you teaching? Are you working with learning disability? What charity and what are you doing?
So
That is
Jane,
not very clear.
if you can just
Elaborate.
elaborate on that. But to be honest with you, if I take it generic, I think there's no sector that you can't
That you can move.
you can move from. From my little experience, I can see that they actually appreciate diversity. So they like having uh, people from probably critical care, for example, surgical units, some from community,
Yes.
from GP, and if charity sector is there as well, they just want to have different. They want to have a team of lecturers with diverse experience. So it might be an additional advantage for you if that is if what you do there is nursing. Bedside nursing in a home for people with complex disability. Yes, if you package yourself very well, I think it might even be an advantage for you, because not many people will have that experience, and I'm sure the university will be happy to, like I said, they appreciate diversity, so they want to pick somebody from different spheres of experience. Except Pat have
Mhm.
something else to say to that.
Oh no, you're absolutely right. I think Jane put it in the chat there. She said yes, bedside nursing in a home for people with complex disability. Like our host has well, nurse Adekola has just said that there's no place that you cannot move from. One thing I just want to add is that you need, if you're coming straight from home, like I saw from your back home, somebody put in the chat that
Yeah, someone is
if you're
asking, can
coming
you
with
go straight to teaching
COS.
after qualifying
Yeah,
as
so
a registered nurse?
yes, and then somebody's also saying for those of you us who came in with COS. So if you're coming straight from abroad and you just got into the NHS or any healthcare sector, and you are practicing, I would recommend that you get some months or some years of experience. That years of experience will sharpen your skills, your UK related skills, things that you never knew back home. You have that time to learn them, master them, then you can teach. Even if you had a background in teaching back home, the culture in the UK is different, and I would strongly recommend that you get that experience with communication, experience with interacting appropriately with people, experience with the paperwork, guidance and policies and procedures, experience with paperwork, everything. Because teaching at the university, you're not teaching primary school children who may probably not know what they're doing. You're telling them what to do. You're teaching adults who may actually research what you are going to teach them for that day, even before coming to class. I'm sorry I have to use this. I'm a straight talker and I don't pretend. Especially the fact that you are black. If you are black, a black audience, you need to get ready, guys, because there's this perception. It has been done to me. Yeah. People underestimated what I could do just judging by my skin color. People underestimated what I could do just because I'm an overseas nurse. Some people just look at you and they feel like you're coming from one jungle, you're not going to offer anything. So you need to prove them wrong. To prove them wrong, you need to get the experience you have with the experience you have, the one you've come with, and the one you're going to learn about them. Then you do it right. Because if you get it wrong, guys, if you get it wrong, you will be really hurt. because that is when you will be brought right down. They will just cancel everything and feel like you don't know anything. Have you ever wondered why an overseas nurse is more likely to be referred to the NMC than a UK based nurse? Have you ever wondered why not just an overseas nurse, but a black minority nurse is more likely to be referred to NMC for fitness to practice reason compared to a UK nurse? Sometimes it's just the cultural difference. Sometimes it's the cultural misunderstanding. These referrals, over 60% of these referral to the NMC comes from the managers, the people that are supporting us directly at work, because they don't understand us. They don't understand the stuff we're made of. We need time to understand each other. We need time to understand the ground rules. We need time to understand the culture. Do you know that in teaching, not just in teaching, even in nursing care, there's a big difference, big cultural difference. If I am talking to my fellow African or my fellow African student, what I'll say to them and they'll take it smiling. If you say that to a British student, you
It's
will
bullying.
be you will be plying down the bullying road. You will be answering questions. You will be referred to behavioral challenging behavior trainings and all sort of things, simply because there is this misunderstanding. Just body language, for example. Do you know in England, if you look someone, I mean, somebody's talking to you, maybe your boss, and you look away, do you know that is rude? You need to look them straight in the eyes, which is rude for me, but it's not rude to them. So if you're coming straight from home, and also one big thing, you don't tell people, you ask. Okay, there's big difference between asking and telling. You can't tell the student, get up, come here, come and do this. Can you need to do this, you need to do that, because you're the lecturer, you're telling them. Because where we come from, our background, as a lecturer, you tell the students what to do and they do it gladly. you know they do it smiling. But here you ask, are you happy to do this? Is it okay to do that? Is that all right if I do this? Is it
Are you
okay if I
happy?
give you some?
Are you
Are you
happy?
happy to do this? Whether you're happy or not, they're asking you, and they're not asking your opinion. They're not asking you to say, "Oh no, I'm not happy." You just say yes because they're asking you in a polite way. So simple things like this, guys.
So I know
If you don't learn,
I know you've had a lot of sessions about cultural adaptation, and
yeah.
that looks like your specialty. You have very good stuff on that. So if I leave you to keep talking about cultural adaptation, I'm sure you're going to be here overnight
Yeah, thank you very much.
as
And
well.
yes, Adekola, you're right. I am passionate about international cultural competence. And if you're here and there's something at your workplace and you want to invite someone to speak to, either your managers or your international nurses, to be able to understand each other more, feel free to contact me. I'll come and have a session. Or you have a new overseas nurses coming from abroad and you want to sensitize them around UK culture, feel free to invite me. In my introduction in the beginning, I forgot to mention that I am a certified learning rep with the Royal College of Nursing as well. So I do speak on the RCN platform around culture shock and culture competence. And under the RCN platform as well, I support many NHS organizations out there. So feel free to invite me. I don't charge, okay? It is my passion. It's just something I need to give back. Because I just feel like,
You are that kind, isn't it?
yeah, I just feel like I wish someone told me. I wish I had the opportunity to learn from these people. Maybe I wouldn't be that hurt. My journey in the NHS was like a roller coaster. I had the good, the bad, and the ugly. It was painful. Um,
But we thank God for where you are now.
yeah, but there are people who had wonderful experiences. It's different for everyone. But one thing with me is that I didn't let it weigh me down. I just decided to reflect on it and bounce back, and that's what I'm doing now. So
So if I just go through some of the questions we have in the chat
okay,
box,
yeah.
uh, Adewale is asking, for those of us that came in with COS and skilled worker visa, how do we do the switch? I assume probably she's concerned about getting sponsorship with the university. So universities, they are always happy to give you sponsorship as well. So they give you skilled worker visa. So it's not a major switch as it were. So it's just like you're changing
Ye-
trust. So you have another
Yes.
employer giving you a different. The only difference I can say from there is in the clinical setting they give you a and care visa, but the university give you the actual skilled worker visa, if that makes sense. Okay, but it's still skilled worker. So the only difference is probably you have to pay your ETSO charge yourself this time because you are not exempted from the IHS, unlike that of the health and care visa. But they give you skilled worker visa as well in the
Yeah.
university.
So the simple way to start is just to find a vacancy. So if you find a vacancy and you apply, nobody's going to be asking, "Oh, is he on COS? Is it?" They want to see what can you offer. Are you ready to offer it? Would you need a sponsorship? That's it. It can be easy as that with some universities. So switching starts from what do you want to do and have you found it? Okay.
So someone said, can you go straight to teaching after qualifying with work? I think that has been mentioned. You can, but I think it's always best to pick experience from the clinical side because you need to know what you are giving out first of all, and you like Pat mentioned, the students, it affects the way they receive from you as well, their estimation of you. Okay, when I just started, I've had students ask me, I was just supervising them with just manual blood pressure for goodness sake, training them on manual blood pressure. And I have students asking me, have you done this before? Like,
Can
like
you imagine that?
do I really know what I'm doing?
Can you
I was
imagine
like,
that?
oh my God. I've been doing this for 16 years. And one of the lecturers there said to me after that I'm too humble. That's why they're asking those questions, that you need to blow your own trumpet as well as much as possible so they can, because it's literally affect how they receive from you. If that person, the person is bold enough to was bold enough to ask, others might be nurturing it and they will be withdrawing. They just, anything you are teaching them, they just be like, what's he talking about? Does he really know what he's saying? And in the end, there's no learning taking place. And
Mhm.
that is your own, is the beginning of your own failure as well, because what's the
Yeah.
point when you are taking your time to teach and the students are not taking in what you're teaching them? So from the next class, once they introduce me to a new set of students, I tell them, oh, my name is this, I've been practicing for this number of years, I've had experience here, and they be like, oh, you don't look it, you don't, yes, you don't look it, but it's for you to know. So, and you notice a change automatically, there is a change in their attitude and they want to listen to what you have to say. So sometimes it's always good you have that kind of experience you can draw from. Okay. Someone is asking if you have, okay, that's Jane now. How many hours of class do you have to talk or teach in a day versus your paperwork or computer work? So Tosin is asking, they just want to know how much time you spend in classes, how much time you spend behind the computer.
Yeah, that's a good question. So it depends on the group you're supporting. Okay. Um, when I was doing skills, I tend to teach at the university more. We have skills that come 3 hours at a stretch. However, you don't teach continuously for 3 hours. You teach for an hour, you take a break, teach another hour, you take a break, which is quite different from where we're coming from. Where I'm coming from, my lecturer has kept me sitting down for like 4 hours straight. Some people even stay for eight. And my place where I come from is not as cold as here. You know, it's so warm and there may be no fun. But yes, 3 hours sometimes kills, sometimes maybe 6 hours, but divided into two. But that's kills, and that's not every day. It could be 2 days a week or 3 days a week. Then if you do 2 days in class, then the rest of the 3 days either you're getting ready, you're preparing lectures, or if you do 3 days of teaching, you have 2 other days doing your stuff on the computer and just getting ready for the next session of what you're going to do. You have time to prepare. Okay, you have time to prepare, and you could use the YouTube to prepare. You can use the Canvas page to prepare. There are loads of preparation resources as a lecturer for you to prepare yourself for the lecture and for the time excuse me, to get into class. So it is not non-stop every day, but it could be 2 to 3 days a week. And your weekends are for you. You don't need to work during weekends. So you're free. If it's bank holiday, you are free during those bank holiday, except if you just want to go on your computer, which we don't recommend, but people still do. Yeah. But currently, for the group that I'm supporting, it depends on what days I want to see them. So if I want them to come face to face in class, mostly because my students are international students. So international students, some of them enjoy face to face teaching more. But when I have covered all the things I need them to know, then the last few weeks we can meet online, maybe for tutorials. So it's quite flexible. We do a bit of both depending on what the students want and depending on what the structure of the course demands. Okay,
Okay,
I don't know if that has answered your question.
thank you. Someone is asking if we switch to education, don't we have to now start paying IHS surcharge? I think the answer is yes, because you're no longer on health and care visa, so you'll be paying IHS surcharge. But on the flip side of it, you just have to put it side by side what you want and what you don't want. Like Pat said, most of the institutions, they will support you with your trainings for your PG SATs, for your
Yeah.
masters, and these are expensive programs.
Yes.
Okay, so if you put the cost of your masters, probably almost £8,000 that the university is going to be supporting you with, if you put that with your salary, and think about it, put it side by side with the IHS fee that you have to pay, and you just you just make the decision. But it's good you ask. You have to do what is best for you anyway. But
Yeah.
that's how I think is. I just think if I have
Yeah.
to
And
save if I have to save that much to get this qualification myself, how much is it going to cost me?
yeah, you're right. And also, the RCN worked really hard to scrap this IHS for health workers. They are still working, so we remain hopeful. Hopefully, that will be scrapped at some point. We're just hoping, because the RCN is doing a lot of work around supporting um, qualifi- international professionals coming to the UK. So something will be done soon, hopefully.
Okay.
Any other
Uh,
question?
yeah, someone is asked. I think a lot of them, a lot of my people want you to come back for cultural adaptation. They look quite keen about that. We can always have a different section on that,
Yeah,
subject to
that's fine.
availability. That's not a problem for my boss, I suppose. Okay. Someone asking, as a new lecturer, can you choose the course you want to teach, not necessarily clinicals, as I don't even work on the ward presently, because we have different specialty in nursing. I'll I'll let Pat answer that.
Yeah, that's fine. You don't necessarily have to work in. Did you say you need to work in clinicals? What did the question say?
She's asking, can you choose the course you want to teach? Probably
Yeah,
not necessarily clinical
of
courses.
course. Because I started with skills tutor does not mean that you have to start as skills tutor. Like I said, you can start as maybe bioscience teacher. Okay, bioscience lecturer. You can do that, or you can apply to teach research methodology. Those lecturers that do research methodology don't have to go to skills lab, okay, because it's paper based, it's teaching based. Or you could do this modules that you can take that doesn't necessarily have to be. Ever since I moved on to the role that I am now, a more senior role, I can't remember the last time I did teaching. I only did teaching recently when I had to join the advanced practitioner course. That is registered experienced nurses in the NHS coming to our university to do a CBT, and they had to do Viva. So one of the assessment is to do verbal assessment of deteriorating patient, and I joined that team. That actually the only thing that made me to have a skills session with them. Most of their courses are online anyways, but they requested that they wanted a face-to-face session in the skills lab to kind of do the assessment while they're watching me and talking to me, and I just offered them that. If not, I have not done skills teaching for a while. So you can choose what you want to teach. You can choose based on the advert. You don't have to teach skills. Okay.
Yeah, what I didn't know, I didn't realize before as well. was the fact that lecturing here, they have different roles. It's not just generic like lecturer. So
Mm-mm.
when I was applying, I just saw, oh, lecturer, and then I applied. But getting into it, I realized there are different sections, different roles for different. Yes, you do a bit of things in common. You support with a lot of things, but there are different roles as well in it. And even when you have to do teachings, I've seen them ask me a lot of time your area of interest, your area of expertise. Even if it's not your module, if you let them know this is my area of interest, they are always happy to get you in and let you carry on with your passion and teach. If they
Yeah.
notice, oh, you have probably special experience in community setting or prison nursing or whatever, they will
Yeah.
always be happy to bring you in for sessions. So
Yeah.
there's no knowledge, no skills that you have that is wasted. I'm
That
sure they
is
will
true.
appreciate you for it.
And that is true. And that's the big difference between our training back home and theirs here. When I came here, I thought it was a limitation, but I just thought it's a strength. Like we have pediatric nurses, we have adult nurses, we have learning disability nurses. And in the trust, we have the pain team, we have the diabetic team. So because you're in the diabetic team and you can do well, you can come and teach diabetes module, in the university, you can come in as a lecturer practitioner and tell them that this is your specification, that's your comfort zone, this is what you want to do, and that's what you're passionate about. That is what they will give you because they want the best from the expert, and you are the expert. So they will use that opportunity.
Okay,
So I,
sorry. While you're on that, just to encourage any other person as well, one of the things I've come to realize again is most of the universities around, they're always looking out for uh, clinical nurses to partner with as guest lecturers.
yeah,
Okay. And apart from the fact that they're going to pay you for the session, which is good money, but it's also good on your CV. So if you have intention of transitioning to you have a plan to transition into teaching as well, you might start looking at the institutions near you, okay, and get in contact with them. You can even call the HR directly, introduce yourself, let them know, okay, you are a pain specialist, or this is your uh, area of expertise, and you like to support with teaching sections on this, you like to support with skill sessions in this direction. I can
yeah,
tell you, they will really jump. They will stand on their feet. They will jump at you. They
yeah,
are looking for people that have up to date clinical experience to come and support their teaching sessions.
yeah,
And if you've done that, maybe even if it's just once a month, you go to a university to do that. It's on your CV, my darling. Then when you go for interview, you have that confidence to tell them you've been doing this, and that's an additional advantage for you compared
yes,
to other candidates. So
yeah,
that's something you can look into as well.
yeah.
Okay,
And I just wanted to add, it's not just good money; it is very good money. It's better than the bank shift that you pick up. Trust me.
it is.
Yeah,
I can tell, and I
yeah,
I was envying guest lecturers, the
yeah,
few ones I've seen when I get to know what they are taking home. Is
yeah,
you might start thinking about spending your free time as guest lecturer rather than
yeah.
going for bank shifts. It's worth it. Someone is asking, what if you have an education degree and half RN? What do you recommend?
That is a ready-made package already. You have
You are
education
ready.
and you
You are
got you
ready
have
to go.
RN. You are good to go. You just need the experience you want in the NHS to function well in that field that you want to teach. Okay, there should be nothing stopping you. Okay, you should be good to go.
You might even apply as a senior lecturer directly. I'm telling you, just give it a go.
Yeah,
So I
give it a
I
go.
know
Why not?
I've I've seen a
Why not?
couple of people coming directly from the bedside and coming in straight as senior lecturers. They've never
Yes.
taught before. They don't have
Yeah.
any teaching experience, and they are coming in as senior lecturer from day one.
And the
So it depends
university will
on
support you.
at the university. It depends on how you package yourself.
Yeah,
So
package.
that's a complete package, Grace Chukura, that you already have there. Okay. Before I let you go, Patience, can you just share with us any memorable moments or success stories from your time as a lecturer that has stood out for you?
Lovely. Thank you very much. Guys, I'm more than happy to share this. You wouldn't believe this moment in 2021, 22. There was this award ceremony, and this girl here talking to you from a black background that came into this UK very timid, very fearful, very scared of so many uncertainty. You know, I got into the university, started to teach, do my own thing, enjoyed it, and I was being nominated for 6 awards. Six, six. Let me name them. The first one was
Wow.
Excellent Teaching Award. The second one was Outstanding Supervisor Award. Third one was Special Recognition Award. I had the Inclusivity Award. I had the Best Personal Tutor Award. And I was also nominated for the Student and Staff Collaboration Award. And that was amazing. That really stood out for me. I was so grateful that I had that when I joined the university as a lecturer from overseas background. I was well, although I sounded very confident during my interview, but when I got in, the nerves started to tell me, you know what, patience, are you sure you want to do this? Which is a normal thing, but I carried on, and I was being recognized, and that was amazing. That moment really stood out for me. And on that note, I just want to tell anyone out there, if you believe in something, you think you can do it, you definitely can. Okay, you most likely can do it. Go for it. Don't listen to what negativity that is coming around you. Just remain focused, remain positive, try it. Okay, when you don't try something, then you have failed. Okay, but when you try the same, when you don't plan, you plan to fail, something like that. I can't remember how it's been said, but if you believe that you can do something, there's no harm in trying. Go for it, and then be deliberate about it. Your CV, have you prepared it well? Your application, did you package it well? Did you read all the right information, and have you included all the right information in your application? And if you need help, ask. Ask. Research has shown that the overseas nurse is more likely not to speak out. Okay, she's more likely not to speak out when she's struggling. Sometimes we struggle alone. We just want to lay back or let them not say, I don't know. When you ask question, you get the help. Okay, for me in the NHS, I didn't ask too many questions. I was crying alone. But when I got into the universities, I asked so many questions, and people were there to support me. You have me. You have me to ask. You can get in touch with me either from my Twitter handle. Okay, Patience Bamisa one. I'm on Twitter. Just find me, and then inbox me if you need any mentorship, any question. We can always banter. If you're going to RCN, you're a member of the RCN, let's meet at Congress. Let's talk. This life is all about networking and asking questions, and you will definitely find yourself in the right place. So I wish you all the best.
So
Thank you so much for having me.
I'm going to put patients contact details in the comment section. So just for anyone that wants to get
Yeah,
in touch, get in touch
thank
with her. It's always good to connect. And I think you've gained one or two things from this section. If you are with us and you find this section helpful, please just give it a thumb up, give the video a thumb up, share with everyone that you think
yeah.
they're going to benefit from it. If you are if you are yet to subscribe to our channel, please subscribe so you don't miss subsequent educative sections that will be coming up. So Pat, we really appreciate you for coming, and thank you
Thank
very
you.
much. It's a privilege to have you. Uh, our audience are so much grateful to have you as well. And if
Thank
there
you.
are other burning questions that you have that are not yet answered, just put them in the comment section. Then we'll get parts any other time. Don't worry, I can grab her just over the corridor. I can grab her anytime. Then I'll bring her back to answer all your questions. Okay.
Lovely. Thank you very much,
Unfortunately,
Nurse Adekola. Thank you so much for the opportunity. And thank you guys for all your love. I can see all the little hearts. Please subscribe to his channel. I really respect this man. He's very knowledgeable and he knows what he's doing. Thank you so much for your love. I can see all your kind words. I'm very grateful. I'm very humble. Follow me on Twitter and then we'll talk better. Okay. Thank you very much, guys. Well done and
thank you.
carry on.
Yeah.
Okay.
So unfortunately, that's all we can take for today. So thank you all. Thank you so much, Pat, for sharing your wisdom with us, and thank you all our viewers for joining us. Again, don't forget to like, share, and subscribe to the channel for more insightful content. And until next time, I remain your boy, Nausa Adekola. See you again this time. Cheers, everyone.